My dear friends, today I'll be discussing about the various risk factors of gastric carcinoma or stomach cancer. Now, what is risk factors? The risk factors of a disease simply means those factors which ultimately increase the risk of getting certain disease. But presence of certain risk factors does not increase the incidence of the disease, but of course it prone a person to specific disease. Even it has been found that presence of risk factors may not leads to a particular disease, but even absence of risk factor can also lead to a disease by some unknown mechanism also. So when it comes to stomach cancer or gastric cancer, there are multiple risk factors which ultimately increase the chance of getting stomach cancer or gastric cancer, but it has been found that that in many patients gastric carcinoma has been found but without any specific risk factors. So without any risk factors also, without any known risk factor also, a certain disease can occur also, and many subjects who are having multiple risk factors, they may not get the gastric cancer also. So risk factors increase the risk of getting certain disease, and for gastric carcinoma, the risk factors will increase the risk of getting stomach cancer or gastric cancer. But presence of a risk factor does not mean that the disease will be the stomach cancer will be there, or the patient will suffer from gastric carcinoma in majority of the cases. So even many patients who suffer from gastric carcinoma may not have any risk factor or very less risk factors, and many patients with multiple risk factors may not get gastric carcinoma also. But still, knowledge of the risk factors are very important, as some modifiable risk factors, if you can modify or prevent it, can ultimately help in preventing or prevention of getting gastric carcinoma in various population throughout the world. So knowledge of risk factors is very much important, as it helps us in treatment strategy, taking preventive measures as well as prevent the progression of the disease, and for improving the prognosis of the disease. So knowledge of the risk factors are very much important. So today we will discuss about the various risk factors of stomach carcinoma. So number one risk factors of stomach carcinoma is gender. It has been found that most of the patients are male compared to female. That is, majority of the gastric carcinoma patients are male, or men are more predisposed or are at higher risk than compared to female. So gender is an important risk factor. Because of gender risk factor, men are more prone to have gastric carcinoma compared to female or women. Besides, it is found that another important risk factor, but it is unpreventable or unmodifiable risk factor, that is age. It has been found that beyond 50 years, a person is more prone to develop gastric cancer or stomach cancer. Besides, it has been found that gastric cancer is very common in population of ages from 60 to 80 years. Besides, ethnicity is another important risk factor. Gastric cancer has been found among American, African American, Native American, as well as Hispanic Americans. So it is common among African American, then Native American, as well as Hispanic American. When it comes to geography, it is also very important risk factor, because stomach cancer is very much common in China, Japan, Southern and Eastern Europe, as well as Southern and Central America. So these are the various important locations or geographical locations which are very much prone to develop gastric cancer or stomach cancer. Another important risk factor is H. pylori infection or Helicobacter pylori infection. Helicobacter pylori is a bacteria which affect the stomach gastric glands, and which invade the gastric glands, multiply there, and ultimately have some enzyme known as urease, which is responsible for breaking down of urea and making a alkaline atmosphere, and they can survive in acidic atmosphere of gastric glands also, or even low pH of stomach or gastric acidity. They can survive because they can produce an enzyme known as urease, which can break down urea to produce ammonia, which is a very strong base and ultimately neutralize the acid. So Helicobacter pylori infection is responsible for gastric ulcer, and it also increases the risk of gastric cancer and as well as stomach cancer. Especially lower and distal part of the stomach is involved, or cancer of the lower or distal part of the stomach, that is pyloric antrum, pyloric and gastric antrum part of the stomach is involved when Helicobacter pylori causes gastric cancer or stomach cancer. H. pylori, when they undergo long-term infection without any therapeutic intervention, it leads to chronic atrophic gastritis, which is a precancerous lesion, and if it persists for longer time, may leads to gastric cancer or stomach cancer. Besides, H. pylori infection also leads to lymphoma of the stomach or gastric lymphoma. But it has been seen that many patients who are having H. pylori infection or in their stomach or gastric mucosal area, still they don't suffer from any gastric carcinoma even after many years of the infection. So though in some patients H. pylori infection can lead to gastric carcinoma of the lower part of the stomach as well as gastric lymphoma, but in many patients it does not cause any cancerous growth or precancerous lesion or gastric carcinoma or stomach cancer, though they are having found to culture or found to have H. pylori in their gastric mucosa. Another important risk factor is gastric lymphoma. It has been found that stomach lymphoma or especially maltoma, mucosa associated lymphoid tissue lymphoma, may increase the risk of adenocarcinoma of the stomach. So presence of gastric lymphoma or stomach lymphoma always increase the risk of gastric adenocarcinoma in many patients or subjects. Another important risk factor is diet. According to various studies, diet is an important risk factors. Especially diet rich in meat, salted meats, then pickles, beside smoked foods, then pickled meat, then pickles, then salted meat, salted fish, ultimately, or canned foods, if it taken for a prolonged period, may increase the risk of suffering from gastric cancer. This is because this salted food, then smoked foods causes lots of nitrites and nitrates. They leads to production of nitrites and nitrates in the gastric mucosa, and this gastric mucosa, because of presence of nitrates and nitrates in the presence of H. pylori infection, increase the risk of gastric carcinoma. This is because these nitrites and nitrates are pre-carcinogenic or carcinogenic in nature. Especially diet rich in fruits and vegetables can protect against gastric cancer. So diet rich in pickled food or high salt diet or canned food or smoked food increase the risk of gastric cancer, whereas the diet rich in fresh vegetables and fruits lowers the risk of gastric cancer. So diet rich in fresh vegetables and fruits not only decrease the risk of gastric cancer, it also decrease many other cancer, as well as it also promotes good cardiovascular health, proper brain health, and prevents anti-cancer therapy also. Especially fresh fruits and vegetables contain lot of antioxidants, vitamins, minerals, which fight against foreign particle, boost our immunity, and fight against various cancers. Thus, diet rich in fresh fruits and vegetables decrease the risk of getting stomach cancer in the long run. Besides, another important risk factor is tobacco use. Now, tobacco use may be important risk factor for getting stomach carcinoma. Smoking actually increases the risk of upper stomach cancer. Besides, it also increases the risk of getting stomach cancer by twofolds, or it doubles the risk of getting stomach cancer. So smoking tobacco is one of the important risk factor for development of gastric cancer. So it is always advisable to stop smoking or avoid smoking so as to prevent the gastric cancer development in future. Beside being overweight or obesity may be another important risk factors. Obesity or overweight not only increase the risk of gastric cancer but also increase the risk of certain cancers. Even it increase the risk of breast cancer, some reproductive cancer. Beside it increase the risk of heart disease, stroke, hypertension, diabetes, then myocardial infarction, heart failure, and so on. So it is always advisable to maintain a normal healthy weight and to cut down the extra fat, or BMI more than 30 should be cut down to make it a normal BMI, so as to decrease the risk of getting stomach cancer especially. Now, obesity has been found that it is associated with upper part of the stomach cancer. So it involves the upper part of the stomach, that is cardiac and fundus and body of the stomach. So obesity and overweight may lead to such a cancer in the stomach which involving the upper part, that is cardiac and fundus as well as body of the stomach. Next important risk factor, previous stomach surgery. Sometimes because of ulcer or some precancerous lesion, stomach partial gastrectomy or stomach removal had been done, but this partial gastrectomy increase the risk of further getting stomach cancer or gastric cancer. This is because when there is a partial gastrectomy, then majority of the acid secreting cells are removed along with the partial gastrectomy. That's why acid secretion is very much less, and which ultimately increase the level of nitrate producing bacteria. They can grow very nicely and produce lots of nitrites and nitrates, and they are very, what are nitrates and nitrites? They are very toxic to the gastric mucosa because they are carcinogenic, and ultimately it leads to the development of gastric cancer. Beside, for partial gastrectomy or for partial removal of the stomach, it also leads to reflux of bile into the stomach, and that's why the gastric mucosa are irritated by bile, and ultimately because of the irritation it may lead to gastric carcinoma in the long run. So previous gastric operation or stomach surgery or partial gastrectomy or gastric removal operations may increase the person to suffer from gastric cancer again. Beside, pernicious anemia has been found to be important risk factor. According to some studies, persons those are having suffering or those who are suffering from pernicious anemia may be associated with stomach cancer or increase the risk of getting stomach cancer. Now, pernicious anemia is because of defect in the intrinsic factor which is produced by from gastric glands. Now, this intrinsic factor produced by the gastric glands can travel towards the terminal ileum and help in the absorption of extrinsic factor, that is vitamin B12. So, in case of intrinsic factor deficiency or intrinsic factor of Kessel deficiency, it leads to vitamin B12 deficiency, which may leads to pernicious anemia as well as megaloblastic anemia. And thus, pernicious anemia has also been found to be associated with stomach cancer or gastric cancer. There is another important disease known as Menetrier's disease. What is that? That is called hypertrophic gastropathy. Here there is excessive proliferation of the gastric mucosa, which ultimately cause pathological change in the gastric mucosa and finally lead to gastric cancer. So Menetrier's disease or hypertrophic gastropathy may be one of the important risk factor for getting gastric cancer. Besides, it has been found that a special type of blood group, that is blood group A, may be associated with stomach cancer. So getting blood group A, those persons who are having blood group A, they can have a screen for gastric carcinoma because blood group A may increase the risk of, or they may be associated with gastric carcinoma or stomach cancer. Besides, there may be some inherited genetic disorder which are associated with stomach cancer. Number one is hereditary diffuse gastric cancer. So hereditary diffuse gastric cancer is a very rare condition. Here in this hereditary gastric cancer, here it is 70 to 80% of this syndrome or this hereditary disease are prone to develop gastric carcinoma. Here there is a CDH1 gene mutation and it also increases the risk of breast cancer. So presence of the diffuse hereditary gastric carcinoma increase the risk of carcinoma by 70 to 80%. It also increases the risk of breast cancer, and also it is because of association of one gene mutation known as CDH1 gene mutation. So this is one of the important genetic condition which may increase the risk of gastric carcinoma, but it is very rare in its incidence. Another important inherited disorder is Lynch syndrome, or it is also known as hereditary non-polyposis colorectal carcinoma. Again I am telling hereditary non-polyposis colorectal carcinoma, and it is also known as Lynch syndrome. Now it is an inherited genetic condition which involves the MLH1 and MSH2 gene defect. Besides, various other genes are also involved, but it increases the risk of getting colorectal carcinoma as well as stomach cancer. So Lynch syndrome or hereditary non-polyposis colorectal carcinoma arises from some tissue but without any polyp, and this syndrome increases the risk of colorectal carcinoma as well as stomach cancer or gastric carcinoma. Now there is another important risk factor, inherited genetic condition known as familial adenomatous polyposis. That is mutation in the APC gene. That is also a genetic disorder, but there is a mutation in APC gene, and it increases the risk of colorectal carcinoma as well as it increases the risk of incidence of polyps. And in case of stomach cancer also, it also mild increase the incidence of stomach cancer, or it has a mild increase in risk of the stomach cancer. Beside, BRCA1, BRCA1 and BRCA2, these are two gene mutation which are also called inherited breast cancer gene. BRCA1 gene and BRCA2 gene, these two genes are also responsible for increased incidence of stomach cancer or gastric cancer, and these are also inherited disorders that are linked with stomach cancer. Besides, there is another important syndrome also known as Life-Ramoni syndrome. It is associated with mutation in TP53. There is a TP53 genetic mutation, and at the same time it also increases the risk of getting gastric carcinoma or stomach cancer in future. Likewise, there is another important syndrome known as Page-Jaeger syndrome. Here there is polyps in the colon, intestine, nose, airway tracts of lung, then bladder and various other structures. Here in case of stomach and intestine also the polyps can be present, and we call it hamartomas. Now this Page-Jaeger syndrome, they have perioral lesion also around the lips. Some pigmentation may be there or hyperpigmentation may be there around the lips, and as well as perioral lesions or hyperpigmentation may be there. At the same time, it also increases the risk of breast carcinoma, pancreatic cancer, stomach cancer and colon cancer. It is because of STK1 genetic mutation. STK1 genetic mutation it is associated with, and it also increases the risk of stomach cancer, colon cancer, then breast cancer as well as pancreatic cancer. Just for this topic, we must know that Life-Ramoni syndrome as well as Page-Jaeger syndrome increase the risk of stomach cancer. Besides, we have some other important risk factor like family history of gastric cancer. Those family relatives of a particular family who give history of suffering from gastric cancer, their siblings may have a higher risk of suffering from gastric cancer. So positive family history may be again another important risk factor for development of gastric cancer, because gastric cancer may be associated with some gene mutation which may be run in a family, or it may be inherited or transferred from one generation to another generation. Besides, presence of stomach polyps can be another important risk factor for development of gastric carcinoma. Now polyps are of two types. One is adenomatous as well as inflammatory or hyperplastic polyps. Now adenomatous or hyperplastic polyps, out of these two types of polyps, adenomatous polyps leads to risk of stomach cancer or malignant stomach cancer, whereas inflammatory or hyperplastic polyps does not lead to any stomach cancer. So especially adenomatous polyps in the gastric mucosa ultimately increase the risk of getting gastric cancer or stomach cancer in future. Besides, there is another risk of infection known as Epstein-Barr virus infection. Now Epstein-Barr virus infection leads to a disease known as infectious mononucleosis, which increases the risk of lymphoma. At the same time, it also present in 5 to 10% of the stomach cancer patient. It has been found that Epstein-Barr virus can be present in cancer cell for 5 to 10% of the patients. Besides, the type of cancer caused by Epstein-Barr virus, it is slowly progressive and very less progressive and less aggressive type of stomach cancer. So Epstein-Barr virus, which causes infectious mononucleosis, can also lead to stomach cancer and it has been found in 5 to 10% of the cancer cells of the patients who are suffering from gastric cancer. Besides some occupations, we know that occupation history and occupation can also prone a person or increase the risk of certain disease in various occupational working person. For those person who are working in coal and metal industry, coal mines, rubber industry, for them they are very much exposed to various carcinogen which ultimately increase the risk of development of gastric carcinoma or stomach carcinoma in future. Beside, there is a syndrome known as common variable immuno syndrome. What is common variable immuno syndrome? It is a syndrome where there is immunodeficiency. It increases the risk of getting stomach cancer, gastric cancer, as well as gastric lymphoma. It is associated with various infections, then pernicious anemia, then atrophic gastritis. So, common variable immunodeficiency syndrome is a sum of a syndrome where it is associated with stomach cancer as well as gastric lymphoma. Here it is associated with infections, then pernicious anemia, and atrophic gastritis. So these are the various risk factors of gastric cancer. Out of this, smoking, alcoholism, then H. pylori infection, poor diet like diet rich in nitrates and nitrates like salted meat, salted fish, then pickles or pickled meat or smoked food or carbonated food, they may be, or burnt food, they are more prone to develop gastric carcinoma in future. So there are many important modifiable risk factors, and knowledge of proper risk factors are very important as it helps in prevention of certain cancers. Even for gastric cancer, it is to be found to be very much true. If you know the modifiable risk factor and if you can cut down the risk factors, then risk of getting gastric carcinoma can be decreased, or incidence of the gastric carcinoma can be decreased. And we must not forget that prevention is always better than cure. Thank you very much.